So I just finished my breathing exercises with Bryan, and he's an amazing teacher. I'm not the best listener because there was a couple times that I was doing the breath work where he was saying, you know, I want you to breathe in slowly and then breathe out slowly and then hold it. And I was actually holding it in, which is something that we shouldn't do. So anyway, it was a great experience, I have to say. I mean, I've done lots of breath work over the years, and I can honestly say that right now I feel like in a half meditative state. I feel no anxiety, no stress. My body feels very, very relaxed. It feels very relaxed, even though I was doing it wrong. Some of the breathing exercises I was doing wrong, but that's okay. I mean, we're all here to learn, and it's like it's you know, I'm glad that I went through that process, because now I know what I was doing wrong, and now I can, you know, improve that. So I really like Bryan's philosophy and the way that he talked through it. So I'm going to let him take over now and just kind of give a recap of what we went through, and then the different types of breathing, the 3 different types of breathing, and how he was teaching me about the carbon dioxide and how to maximize and slow down your breaths for maximum efficiency in your body. So Bryan, why don't you take it away?
Okay, thank you. And hello to all you beautiful listeners out there. I love doing this with you because we really, I feel your energy through the screen. I feel so connected to you. And we had a great session no matter what, right? I mean, you know, people make mistakes and it's okay. It's a learning process. It took me, I mean, I've been doing this now for 5 years and I didn't get it right away. So it's okay. The point is that you feel better. And if you feel like you're in a more meditative state, then that means we achieved our goal. We increased your heart rate variability, which increased your vagal tone, and it brings pain and inflammation down. So if you're in a meditative state, the body can't be in pain. The body can't be inflamed, right? It's all about normalizing our blood chemistry. Now, when I say that term, most people will be like, well, what does that mean? So in terms of respiration, we all know that if I breathe in, I bring in oxygen. And when I breathe out carbon dioxide. But even that right there is a little bit reversed, because the neural drive to breathe is to exhale. And our immediate thought is I breathe in and breathe out. In actuality, it's I breathe out and then I breathe in. My body has to remove the waste first. It has to remove the metabolitic gases. So carbon dioxide isn't a waste gas in the human body. Carbon dioxide is produced by every single tissue in the human body, and it's produced by daily metabolism. And daily metabolism is breathing out and breathing in. So I'm always going to have a certain level of carbon dioxide in me, and it's a good thing. I don't want too much. I don't want too little. I don't want too much oxygen. I don't want too little oxygen. I don't want too much water. I don't want too little water, right? We're always looking for that balance in life, yin and yang. We really got to come to that point of realization. You know, it's almost like people will use the word moderation as balance, but moderation means, well, I'm drinking 1 cup of coffee every single day, and that's not bad for me, except that's 365 cups of coffee in a year, and 3,650 in 10 years, and that's constantly acidifying my body. That's not balance. That's an acidic way of looking at life. When we actually bring our blood chemistry back into balance, which is the relationship between carbon dioxide and oxygen, we start to have higher thoughts, because we start to resonate a higher frequency. Because when our blood gases are balanced, we remove the waste out of our body. And as we remove the waste, we combust the energy, which is the oxygen, at a less toxic rate And then our brain is got this ability to function on a higher level because there's no brain fog, right? So what I teach are oxygen advantage principles, which are based on the Buteyko method. So my teacher, his name is Patrick McEwen. He was a 15-year Buteyko teacher. Now, Professor Buteyko is considered the #1 pulmonaut, meaning pulmonology, lungs, pulmonaut who's ever lived. He took breathing to a new level. But the only reason he's not one of the most famous scientists is because he grew up behind the Iron Curtain in Russia in the 60s, or even before that. So his information was only known in Russia, and he was considered to be a god. They gave him a mansion, a car, everything, because he was curing people. And when the Russian cosmonauts went to space, when they came back from space, they walked off the aircraft where the Americans were carted off, because he already knew about cellular respiration and had them doing specific breathing techniques where they wouldn't lose bone density in space. So they were doing these techniques in space. Now, where did he learn from? Well, he learned his information from Professor Christian Bohr, who was the father of Nobel Prize winning quantum physicist Niels Bohr. And in 1904, Professor Bohr originated this law of cellular respiration, not breathing in and breathing out, but what happens inside the red blood cell. And he was 85 when he originated this law in 1904. So like the crowning moment of his career. And again, I always say this like 5 times, it's a law of respiration. So since 1904, it's been around, and yet we don't understand it because we weren't taught it in school. And if everybody was taught the law of cellular respiration, things would be different right now. We would have advanced breathing techniques. We would have everybody meditating, because we would have understood that through this law of cellular respiration, we can heal ourselves from the inside out, because that's the way God designed us to be. We're supposed to transition peacefully through natural causes. Natural causes doesn't mean the body dies. It doesn't mean that the body has death. It means that it transitioned into another dimension and then maybe reincarnated or whatever. But there's no death. There's only transition of tissues, right? Now, I'm going to try to describe this very simply to the listeners. So here we are, and we have actually, I also want to be able to share my screen, which I don't think I'm going to be able to do right now because I'm not, do you have the ability to make me a host?
Yeah, you should be able to share your screen.
Oh, good. Okay. So before I share the screen, I'm going to pull this up. So this is a very short little diagram of, am I big on the screen, or is it you?
Yeah, you're on the screen. Yeah.
Okay. I need to see myself big. So this is what happens inside your body when you breathe out air and in air. So here are your lungs. So you're breathing in oxygen. Everybody's heard of alveoli. This little circle are the little tiny sacs that line your lungs, and they allow oxygen in and they allow CO2 out. Oxygen in, CO2 out. This is a capillary. Now, a capillary, one strand of hair fits 10 capillaries. That's how small the capillary is. So that means it can only fit one cell. That one cell is this bigger diagram. It's your red blood cell, RBC, red blood cell. So when oxygen comes in the alveoli, carbon dioxide comes out the alveoli. Now, the analogy I like to use is that the oxygen molecule is a child. And the child left its home, which was the lung. It left its home, and it went into the into the capillary and it got picked up by the school bus. The yellow school bus is the red blood cell. Now, when the child gets on the bus, it sits down and it has to get seat belted in. Otherwise, it's not safe. So oxygen, when it enters the red blood cell, it needs a carrier. And that carrier is a protein called hemoglobin, Hg. So the hemoglobin is the black line. The red circles are the oxygen molecules. Hemoglobin has a heavy iron atom. The reason iron is so important for humans is because it's at the center of hemoglobin. And hemoglobin shuttles oxygen throughout the body. This is important because this is how we respirate at the tissue level, not the nose level or the lung level, but at the tissue level where you need it the most. So once oxygen is picked up by hemoglobin, hemoglobin holds on to 4 oxygen molecules. Now, I'm going to stop for 1 second. In the last 2 years, everybody has had a pulse oximeter on their finger. And when you read that pulse oximeter, they're looking for your oxygen saturation to be between 95 and 99. If it's below 95, then they're going to say you might be presenting a respiratory illness. And that's understandable, right? Ideally, we want to be between 96 and 98. If I'm 99, people go, they do a hyperventilation technique to oxygenate their body. And that's not actually correct. You're bringing what's happening when you do hyperventilation, you're not oxygenating your body, you're binding oxygen to hemoglobin. If I'm 99% saturated with oxygen, now we're going to move to this screen. If I'm 99% saturated with oxygen, this is Professor Bohr's law, and it's so simple. They didn't call it the Bohr law. Scientifically, it was called the oxygen hemoglobin dissociation curve. Dissociation means how do we get oxygen to liberate from hemoglobin? So it's just a fancy word for liberation of oxygen. On this side of the graph, we have oxygen, hemoglobin percentage saturated with oxygen. So in this circle, on the left side of the graph, if I'm 99% saturated with oxygen, right? If my oxygen saturation is very high, it means none of the oxygen molecules are leaving the cell. If I'm 99% saturated with oxygen, very important for the listeners to know this. If you're 99% saturated, then your oxygen molecules are binded to hemoglobin, which means they're not getting to where they need to go in the body, and that's how aging happens. First, it's inflammation, and then inflammation causes degeneration of tissues. Then we get degeneration of organs. So it's called oxidative stress. It's really just one word for disease, and it's oxidate, 2 words, oxidative stress, or one word would be acidosis, right? So we're not understanding the ability of the power of cellular respiration. Now look at the graph. If I'm 99% saturated with oxygen, my blood pH is supposed to be normal. That's the blue line. The number is 7.365 to 7.4. That means slightly alkaline, slightly. So if I'm slightly alkaline, then we know that viruses are pH sensitive and they can't thrive in an oxygenated environment. They need low oxygen. They need waste around them. They live on the waste. The bacteria live on the waste. Any pathogen lives on the waste. If I'm pH normal, and this is where Coherent therapy comes in, right? It helps you to normalize your blood gas and bring your blood to the right viscosity. So we can arm ourselves in many things. We could drink our own urine. We can also learn to breathe correctly, which is the most fundamental physiological tenet that we have is our breath, right? So if my breath is pH neutral, then I'm in a good state. And now, Dr. Group, you and I did an example of dimension number 1 of breathing, where we took your breathing down to barely breathing. I asked you to breathe in as little as possible. What that did was it shifted the curve to the right. So down here we have partial pressure of oxygen, and here we have partial pressure of oxygen bound to hemoglobin. So when we did our biochemical breathing, breathing light to breathe right, we shifted the curve temporarily into the acid domain because we increased carbon dioxide by barely breathing. When we increase carbon dioxide, now we're coming back to our diagram, this beautiful little diagram that I drew. So in order for us to get oxygenation at the tissue level, we need carbon dioxide present, CO2. CO2's job, it functions as a signaling hormone for the entire body. Every physiological function that happens in our body needs carbon dioxide. So cellularly, carbon dioxide will go into the red blood cell. The arrow signifies that it signaled hemoglobin to release oxygen. Now that signal means that CO2 is a hormone. Now I've told this to people in the medical industry and they're like, CO2 is not a hormone. I'm like, but in the physiological law, it signals hemoglobin. Anything that signals another molecule means it's a hormone, right? It's so weird how things just get dumbed down or on purpose. I don't know. So carbon dioxide signals hemoglobin to release oxygen. Now that little child that's bound with a seatbelt, it turns into a superhero. And I like to say that superhero is a Navy SEAL. So now the oxygen molecule is a Navy SEAL and it's inside the capillary or the vein or the artery, but now it's soluble. It's not bound to hemoglobin. So this oxygen molecule, this Navy SEAL isn't going on a battle. It's not going into war. It's going on a rescue mission. And that rescue mission is to look for cells in the body that are starving of oxygen. The cells that are oxidated or oxidizing because they don't have any oxygen, right? That's important. Well, you can really see my cut. I cut myself shaving. I have these really crazy razors. It hurts every time I hit it.
I'm sure you have some oxygen going there right now.
Yeah, definitely, because I did my breathing this morning, but I just hit it, it hurt. So, so now oxygen is soluble. So that means that our blood gas is normal, right? We shift the curve to the right. We get carbon dioxide to signal oxygen, but we don't stay there, right? You and I only did that breathing technique for 5 minutes, because if we breathed like that all the time, we would be acidosis. So we don't want to do that. We only want to do it for a technique for a short period of time. So we increase the acid of our body, which allows CO2 to signal hemoglobin to release oxygen. Then we go back to normal breathing, which I taught you was a coherent paced breath of 4 seconds in and 6 seconds out, which was 6 breaths a minute. So if I'm breathing 6 breaths a minute all the time, then I'm constantly having this exchange take place, which means I'm respirating at a very normal level of a blood pH that's slightly alkaline. So I'm going to be doing very well. When you go for your yearly physical, why don't they test your BOLT score, which is your threshold of carbon dioxide? Why don't they test your blood pH? Those two aspects right there are the most important markers. How would you know how your blood is doing if you don't test your blood pH just by looking at markers in the blood? No, you need to know what the pH balance is. Every doctor knows that every chemical reaction that takes place in your body takes place best at that very finely tuned blood pH. It's just common sense, because there's only two ways chemistry can go in the body. Only two. This is how simple it is. The body can either go into alkalosis, which is COPD, asthma, or the body can be acid, which is cancer, diabetes, arthritis, things like that. Now, if I'm breathing through my mouth as a practice, because no one ever taught me to breathe through my nose. If I'm breathing through my mouth and I'm fast breathing, it's going to remove carbon dioxide, because your mouth is not designed to breathe. It's an emergency breathing system. If my nose is blocked, then I can open my mouth to breathe to keep me alive, but it's an emergency system. No animal on the planet breathes through its mouth except for the canine. And when they're relaxing, they're not breathing through their mouth. But the canine, if you notice, they're always breathing fast. They're sniffing, 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 and they can never relax. They're always rambunctious because they breathe too fast. So, and they don't live very long, right? They have much shorter lives because they're breathing too fast. They're producing too much waste. When you breathe too fast, the curve shifts to the left, which means I grow a stronger bond between hemoglobin and oxygen. If the curve shifts to the left, that's because there's no CO2 present. So if I'm breathing here all the time, then I'm starving of oxygen. It's bound. It might be there in my blood, but it's bound. If you took the oxygen levels of a person toward the end of their life, they would be between 95 and 98 until the last moments of their transition. But otherwise, what do you do in the last moments of your life? The breath starts to speed up, right? When someone's passing away in a hospital room, they know they're about to pass away because their breath starts to get faster, because they're trying, their oxygen levels are so bound. The reason they breathe faster is to try to get more oxygen in, but it removes carbon dioxide. And then what happens? What is the last breath? It's out. And as soon as the last remaining remnants of carbon dioxide are out, there's no more oxygen getting to the brain or the heart. The body shuts down, the physical vessel. Very simple, right? If Dr. Group fell from a heart attack on the floor and I'm CPR certified and I jump down to help him and I clear his airway and I breathe into his mouth, what am I breathing into his body? Carbon dioxide. So what's the most important molecule in your body? Carbon dioxide.
So I have a question. I want to stop you right there just for a second. That was a great presentation, but can you explain to people what's happening with the mask situation and all the kids wearing the mask? Because there's a lot of people out there that are talking about that as far as the carbon dioxide, and some people are saying it's a good thing. Some people are saying it's a bad thing. What is exactly happening with people that are wearing, and the kids that are wearing these masks all the time?
Okay, well, let's just say the kid's wearing a mask. Number one, you can't breathe correctly. So you're immediately stifling oxygen from coming into your body. That's quite obvious, right? Now, how could it be stopping any kind of pathogen from going in and out of the mask when you can breathe through the mask? You can breathe through the mask. So how in the world could it stop something from getting into your nose anyway when you're already breathing, right? Now, what the mask does is no one can breathe normally with the mask on. Everybody struggles to breathe. And if I'm struggling to breathe, then I'm increasing my respiratory rate, which is the amount of breaths I take every minute. So if my breathing rate is increased, I'm either going to be alkalytic all the time, which is without oxygen, or I'm going to be acid all the time. So let's say I have the mask on and I'm barely breathing, like you and I did, Dr. Group. Then carbon dioxide is going to accumulate in my body, and it's going to create acidosis in my body, which means I'm going to be more susceptible to getting sick. I'm actually going to increase my ability to get sick because I'm breathing with this mask on, because I'm not breathing normally. So I can't get rid of the waste. Some people are going to breathe really fast with the mask on, and they're going to be alkalytic, which means without oxygen. So they're going to get sick too, right? They're going to have brain fog. They're going to not be able to get out of bed in the morning. They're going to feel like they didn't sleep enough, right? Now, the next slide I want to look at is when we talk about the mask, this is important. So here we have how many breaths per minute you should take, right? So medical textbooks will tell us that 12 to 15 breaths a minute is good. Now, there's a little bit of science, but I think it's simple. I'll try to keep it simple. Supposedly, apparently, when you breathe in every breath, you bring in liters of air. But of course, we can't measure it on a scale because it's air. So when you breathe in, you're supposed to breathe 4 to 6 liters of air in 1 minute. So think of a liter bottle of water. You're supposed to be breathing in 4 bottles of water every minute you breathe. That's normal, 4 to 6. So 12 breaths per minute, which is your respiratory rate, times 500. 500 milliliters of air, which is a normal, healthy 1 breath in. 1 breath in brings us 500 milliliters of air if we're healthy. That's called tidal volume. Very simple math. 12 times 500 is 6 liters. That would be perfect. However, when you breathe in, you have something called dead space. Not every oxygen molecule that comes in your body can be absorbed. It's just, normal. So the dead space of every single breath is 150 milliliters. So if we take 150 away from 500, which is the normal breath, we're now left with 350. So that's 350 of your tidal volume. If you take 12 times 350, you get 4.2 liters. So you're still in the good range, but at the low end. Now, if we are breathing in 6 breaths a minute, if we take in less air, which is what Dr. Group and I did with our 3rd dimension of breathing, which is the psychophysiological dimension of breathing. I asked him to breathe in for 4 and to breathe out for 6, which was only 6 breaths a minute. So 6 breaths a minute, which is your respiratory rate, actually increases your tidal volume. So because you're breathing in slower, your paranasal cavity produces a gas called nitric oxide, which was awarded the Nobel Prize in 1998. So nitric oxide's job, among many, is to take the blood from the lower lobes of the lungs and redistribute it to the entire lobe of the lung. So if I breathe in 6 breaths a minute, I increase the amount of air I pull into my lungs because I'm breathing in slower, lower, and deeper. Deeper does not mean filling my lungs. The word deep means far from the top. And the nose is how you breathe in. And what's far from the top? The diaphragm. So deep means pulling it in with the diaphragm deeply into my body. And I had Dr. Group putting his hands on his lower back. So breathing in deeply into his body. So we still have 150 milliliters of dead space, which is 850. Now my tidal volume has increased from 350 to 850 just by breathing in half of the amount of breaths. 6 times 850 is 5.1 liters of air. So if I just increased the amount of oxygen I brought into my body by taking in less breaths. If I have a mask on, there's absolutely no way that I can do that because the mask is limiting my ability to breathe in slowly and deeply. So Not only that, but every breath I take, it heats up the mask. And now if there's a pathogen or a bacteria floating in the air, it's getting stuck on the mask. It's proliferating at the microscopic level, and it's turning into bigger bacteria. I work with a nurse in Maine. She's a head nurse in the trauma unit, and she had to put the mask on 24 hours a day, which they never had to do before. And she developed a staph infection that she needed surgery. And she's got a scar on her face now because she developed staph from wearing the mask. Every doctor knows the only reason that a doctor actually, do you know, I can't remember this off the top of my head, but in the 30s or 40s, there was a study done, and surgeons would actually operate on people without a mask. The only reason they put the mask on is so they don't sweat or get germs inside an open wound, because you can't pass it otherwise. It has to get into an open wound, right? I'm not even so sure, right? I don't believe in germ theory at all. I believe in terrain theory. I don't believe that you can get me sick. Only I can get me sick. And that would be because where'd my picture go? That would be because the curve either shifts to the left or to the right. Only two sides of chemistry. And the mask is not going to make me balanced. It's going to make me either too alkaline or too acid. And that's a fact. I'm a breathing instructor, a master breathing instructor, and it messes up the chemistry of my body. So I don't know what else I can say except that the physiological law of science gives me that rock that I have to be able to speak my truth. You have any other questions?
What do you think you could share with everybody right now? Maybe a couple methods that they could do as a beginner to start out, and then, so they could start feeling better. And then obviously you have different advanced methods, but is there anything that you can share with our
Absolutely
viewers right now that they can do to get started?
Yeah, beautiful. Good. Let's do it. Let's actually, do you see my screen?
I do. Mm-hmm.
Okay. So, well, you mean you see me, not what
I see you, yes.
Okay, good. All right, cool. All right, so let's, everybody, we're gonna actually normalize our blood chemistry right now, because most of us are not breathing correctly. And now in the 5 years I've been doing this, I've only met one good breather, and she's on another level. That's why I actually named my business tagline Superhuman, was because of this woman who is just incredible, the way she's breathing, and she can do superhuman feats. So what we're going to do is dimension number one of breathing. Now, I want you to remember that it's a technique. It's not how you're supposed to breathe all the time. Most of us are breathing too fast. Very, very few of us are breathing too slow, but that is possible. If we're breathing too little, then we're going to be too carbon dioxide rich. We don't want that. That's acid. But that's going to be very few people out there. Most of us are breathing too fast, so this technique will work. So everybody make sure that you're sitting up. You can't be lying back in your seat. You have to be sitting up, and you have to have a nice straight spine, and you have to make sure that your belly is fully relaxed. Now, this technique is going to be really beautiful because it's going to help you to, one, normalize your blood chemistry, release oxygen, and reduce your breathing volume. Because remember, we're breathing too fast. So this exercise is going to help us to reduce our breathing volume. So everybody just close your eyes, because you're not going to watch me breathe. You're going to listen to my instructions. So observe your breath as it enters and leaves your nose. Focus on the airflow as it enters and leaves your nose. Feel the slightly colder air enter your nose. Feel the slightly warmer air leave your nose. Really concentrate on the air as it enters and leaves your nose. Don't think about your belly, only your nose. Use this as a measure of your concentration. For how long can you keep your attention on your breath before your mind wanders? If you notice the mind wandering a lot during the exercise, this exercise will considerably help you improve concentration because you will get oxygen to your brain. Bring your attention to your breathing. It's normal for your mind to wander, but at this point, as soon as your mind wanders, bring your attention back to your breathing. You may feel your chest move up and down. You may feel your tummy move in and out, but don't try to adjust anything. Just simply become aware of your breathing. When you're able to follow your breathing, take a slow breath in through the nose and allow a slow, relaxed breath out. Slow down the speed of air as it enters and leaves your nose. Breathe in a slow and gentle manner. Your breathing should be so light, so quiet, and so still that you're breathing like a baby. Slow down your breathing so that you feel hardly any air entering and leaving your nose. I'm going to say that again. Slow down your breathing so that you feel hardly any air entering and leaving your nose. Your breathing should be so quiet that the fine nose hairs within your nostrils do not move. You're breathing so lightly that there's hardly any turbulence inside of your nose. At the top of your inhale, bring a feeling of relaxation to the body, and then allow a soft, gentle, relaxed breath out. The air should leave your body slowly and effortlessly. It's very important not to consciously interfere with your breathing muscles or restrict your breathing during the exercise. Don't touch your stomach to reduce your breathing. Let everything relax and be soft. Your breathing volume now should be less than it was before we started the exercise, and that's the goal, to take in less air. So the curve shifts to the right, the red line, which means we're increasing carbon dioxide, we're increasing nitric oxide, which is signaling hemoglobin to release oxygen. So by barely breathing, you're liberating oxygen. And this is contrary to everything you've ever been taught, because you're taught to take a full deep breath in to get more air into your lungs. All you do is bring more air in, but you don't get more oxygen to your muscles, organs, and tissues. So the goal of the exercise is to feel a want or hunger for air. It should be challenging. You should be saying, whoa, this is challenging for me to breathe in barely any air. Now, I don't want it to make you feel stressed. If your breathing starts to get chaotic, stop the exercise. If you feel asphyxiated, stop the exercise. You want to find a Goldilocks zone of barely breathing, but being comfortable with it. So it's the feeling that you would like to take a bigger breath, but you don't allow yourself to. So once again, take a very slow breath in, almost as if you are not breathing. And as you breathe out, bring a feeling of relaxation to the body, allowing the air to leave the body effortlessly. A slow breath in and a relaxed breath out. By taking a slower breath in and having a relaxed breath out, it signifies that you're doing the exercise correctly because carbon dioxide is accumulating in your blood, and it's signifying to you that you would like to take more air in. So this is how we know we're oxygenating our body, because we're feeling that need to breathe. And it's valuable feedback that you're performing the exercise correctly and reducing your breathing volume back to normal. Okay, everybody can open their eyes. Now, I would imagine that most everybody feels very calm right now, very relaxed. But remember, that's not how we want to breathe all the time, because that's accumulating CO2. So, Dr. Group, do you want to tell people a little bit about your experience when doing that, and then we can do the other breathing exercise?
Yeah. It's very interesting because it's like a new way to breathe. It's when most people, like you said earlier, we're never taught in school at an early age how to breathe. We're never taught about going inside and meditating and dealing with the stressors that we have to deal with. I mean, so I think that the majority of people are probably breathing wrong, just because they just do not know how to breathe. So when Bryan was taking me through these different procedures, there was only one or two of them that I did wrong, but it's very interesting because it's just not only slowing your breath down, and by the way, you should always breathe through your nose as well, which is another thing that is very interesting because a lot of times you see people breathing through their mouth. And I love the way that you said that animals breathe through their nose all the time as well. But it was almost like a neurological resetting as well. It's kind of like what I felt. It was a system of retraining of the mental, the physical, the spiritual side of things. And the recognizing, because a lot of times you don't even recognize or pay attention to your breathing. So it was more about, let's just focus now, and going through the process now, it makes me focus more on my breathing techniques, I guess.
Beautiful. You know what I've noticed too is that when we started the exercise at the beginning of the hour, when you were talking, you would breathe in through your mouth to go to speak, which most of us do. But because you just went through an hour of breathing, every single breath you just took, you closed your mouth and you inhaled and then you spoke again. And that's because we reduced your breathing volume and it became normal for you to breathe through your nose. And I noticed it immediately that every time you stopped talking, you breathed in your nose and then you spoke, whereas before you were taking gasps through your mouth. And we have to be careful of that. Everybody out there, when you're talking, a lot of people will go, and that actually is going to increase your breathing rate, and it's going to lower your carbon dioxide levels, which is going to make you too alkaline. And then all of a sudden your brain becomes chaotic. And what Dr. Group said was he felt like there was a neurological rewiring of his brain happening because his blood chemistry came back to normal, baseline. And carbon dioxide is the driver of all physiological functions of getting the brain in line. It actually can help you to realign all 12 cranial nerves, which are other techniques that I didn't do with you today, but it's all about breathing, right? My life is about breathing. It's about teaching people breathing. And now what we're going to do is we're going to teach you a breath technique that isn't really a technique. It's how you should breathe for the rest of your life. So when I was teaching you that if you have 12 breaths down to 6, now we're going to go through that breathing technique. So the first technique you just did was breathing light to breathe right. And all you have to remember is taking in less air with each breath. Very simple. This technique is going to be how you should breathe every minute of your life forever. Literally. This is what I call the go-to breath. I want my athletes doing it. I want my children doing it. Everybody. Everybody should be breathing in 6 breaths a minute. Now, we're going to do it together, and then we're going to have to tweak it a little because some people are going to have a hard time with this. We're going to breathe in for 4 and out for 6. That's a 10-second breath, and that means 6 breaths in 1 minute. So that gives us a higher oxygen uptake. Now, what we're going to do is we're going to find our rib cage because we're going to do biomechanical breathing. So we're going to find our rib cage, and we're going to put our hands at the lower part of our rib cage. So if these are your floating ribs, your fingers go here and your thumbs go in the back. If you're flexible, put your fingers on your kidneys and your thumbs on your floating ribs. Now, some people are going to have a hard time with this because it's going to hurt their shoulders. So if that's the case, turn them around to here. Now, close your eyes again and just listen to my instruction. Before we start our cadence breathing, we want to be able to activate the diaphragm, which is the second dimension of breathing, which is biomechanical. So you're going to learn the 3 dimensions of breathing today. You just did dimension number 1, which was breathing light to breathe right. And now you're doing dimension number 2, and you're activating your body's ability to breathe with the diaphragm. You breathe through your nose, not with your nose, through it. You breathe with your diaphragm. So now as you observe the air entering and leaving your nose, you notice that with every breath you take in, your hands start to move away from the midline because your ribs are pushing them out. When you breathe in, the diaphragm creates intra-abdominal pressure that gives us better posture and spinal stabilization. It can actually prevent us from shrinking in life because your breathing is the shock absorber. It's the air pump of the body. And if we're breathing too fast, we're going to age quickly. If we're breathing too slow, which is very few people, that's usually only people who are on their way out. So this breath gives us spinal stabilization, and it affords us the ability to keep our posture and to keep our integrity of our body, which is resiliency. So as you breathe in, you feel your hands move out. And as you breathe out, you feel your hands move in. Now you notice that it's the air that enters your nose that makes your hands move apart. It's not you trying to breathe with your diaphragm. It's by breathing slowly through the nose that creates the pressure against your hands. That's also very important because it's an automatic response as we breathe in silently through the nose that the diaphragm is going to pull the air deeper into the body. So that's dimension number 2. Dimension number 3 is our psychophysiological breath. And now we're going to put a pace to the breath, which creates a coherency to the body. When the body is breathing calmly, then we increase our heart rate variability, which is intimately connected to longevity, and we increase vagal tone. And if we have high vagal tone, we can't have pain and inflammation. So now I'm going to count for us, and we're going to breathe for 90 seconds, which means 9 breaths. And when I say ready, get ready to breathe in for 4 seconds. It doesn't mean filling your lungs. It means continuing to breathe as effortlessly as you are right now. But as you breathe in for 4 seconds, which is a longer breath, it's just quiet and calm. There's no noise when you breathe. Ready? Breathe in, 2, 3, 4. Breathe out, 3, 4, 5, 6. In, 2, 3, 4. Breathe out, 3, 4, 5, 6. In, 2, 3, 4. Breathe out, 3, 4, 5, 6. In, 2, 3, 4. Breathe out, 3, 4, 5, 6. In, 2, 3, 4. Breathe out, 3, 4, 5, 6. In, 2, 3, 4. Breathe out, 3, 4, 5, 6. Last 3 on your own. Continue. 30 seconds. Two more breaths. One more breath. And hands down. Beautiful. So that's what we call paced, coherent breathing. When I'm breathing calmly, 6 breaths a minute, my vagal tone goes up, and then my brain knows I'm safe and I'm calm. If I'm feeling safe and calm all the time, I can't be stressed and anxious. Stress can happen, but now I have the ability to stiff arm the stress, to see the stress for what it is, and to find a solution for the stress instead of not overreacting to the stress, because I can't control the environment, but I can control how I react to the environment. Now, for those of you that were struggling to breathe out for 6 seconds, this is important. I was stuck at 2.5. When I got to 2.5, I was already done because I was a hard breather my whole life from exercising. So if you were that person who struggled to breathe out, then you should breathe in for 3 and out for 3 for a week. When you can master 3 in and 3 out, then move to breathing in for 4 and out for 4 for a week. Then when you master that, breathe in for 5 and out for 5. Now that's a 10-second breath. So that's good. So if we can get to 5 and 5, great. Do that for a week, then go to 4 in and 6 out, because we want the exhale to be longer, because the exhale is the parasympathetic breath. It helps us to retain carbon dioxide, and it massages our vagus nerve, so it makes us feel better. So if you were struggling, you have a 4-week program. 3 in, 3 out, 4 in, 4 out, 5 in, 5 out, and then 4 in, 6 out. So you now have a 4-week program. And in between, when you're breathing normally, how many times a day should you do that? Well, every minute of every day. But if you need to practice, do it at least 5 minutes an hour, because frequency is better than duration. So if you can do 3 to 5 minutes of conscious, slow breathing every hour, it'll be better than doing just 15 minutes at night before bed. I'm not saying don't do that. You're going to want to do that. When you start to breathe slower, you're going to want to do more. That's the beauty. That's why I get people to do 3 minutes every hour, because all of a sudden they want to do 4 minutes, and then they want to do 5 minutes, and then they want to do more, because you start to feel good. And at first people will say, oh, I can't do 3 minutes every hour, because that's the brain saying, no, right? It's acidic or it's alkaline. So it's already creating roadblocks because it doesn't know any better. But as soon as you start to have the experience and your brain feels calm and safe, you start to want to do more. All of a sudden you want to exercise. You want to go out for a walk because your blood chemistry is normal, and it makes you want to do the things that are better for you. It's really remarkable. And it's all about breathing.
Thank you for that. That was amazing. Tell everybody how they can get in touch with you and learn more.
Oh, great. Thank you. Well, my business is called Quantum Fitness, my website. I don't know if you can see it on the back of my shirt.
Yeah, scoot forward a little bit. Yeah, right there. Okay.
Whoa.
No, you can't really see it.
My shirt. My shirt also has
quantumfitness.org. We're going to put his links anyway on the description, so you can get in touch with Bryan and learn more, take his courses. He was really nice to share some of that information with me. We are out of time for today, but I just wanted you to finish up on one thing, because as I practiced Wim Hof for, off and on, since he came out with his breathing technique. And after I spent an hour with Bryan doing his, I felt completely different and more invigorated than I have doing the Wim Hof method. This is just such a calming breath compared to like the rapid, fast breathing method that Wim Hof has, to the point where this actually makes me want to do this more often versus laying down, taking the time, going into that really hardcore breathing method. If you could just explain the difference real fast between that method and this method. And I know you went into that a little bit in the last one, but this is something that I just noticed that was so calming for me. And the fact that this is so simple, it's not like, you have to stop and go lay down. I mean, you can do this all the time. Like, what are your thoughts on that?
Yeah. Well, the Wim Hof method is great if you're trying to fight bacteria, because hyperventilation creates an alkalinity of the blood. The curve shifts to the left, so oxygen becomes saturated. So it gets a high alkaline environment, so the viruses or bacteria or whatever can't thrive in that environment. But it also doesn't promote good breathing mechanics, because if you're hyperventilating, then you're going to be breathing in fast and rapid all the time, and you don't want to do that, right? And if you're hyperventilating, you're removing carbon dioxide. So the masters, the first limb of yoga isn't moving, it's sitting still and breathing. The first limb of yoga is meditation. It's to sit still and breathe as effortless as you can. Now, Wim Hof doesn't really look very good. He looks like he's 80 and he's only 66. I don't see, I mean, he's great. He's in great shape, supposedly. He does all these great feats of strength. But if he has a heart attack at any point in life, it's going to be because he's been hard breathing his whole life. Athletes don't live long. That's a fact. Athletes die young because they've been hyperventilating. So if I'm hyperventilating all the time and I'm creating a sympathetic response of my nervous system, I'm upregulated, I'm not balanced. The body thrives when it's in balance. So when we learn to breathe low, slow, and deep, we create that yin and yang, which is the breath. The spiral of the colder air going up and the warmer air going out. That's yin and yang. The spiral of my breath is the womb of my creation. It's the Fibonacci spiral. If I'm breathing in fast, I'm creating hypertension. I'm creating a tension in my body. So I'm constricting veins and arteries. Fast breathing constricts veins and arteries. So practicing that as a daily technique, I've converted a lot of Wim Hof practitioners and Tumo breathers, because I get people back to being subtle, right? You have to learn the fundamentals, the foundations of breathing before you can ever do a strong breath technique. I've converted lots of yogis, right? And then I told you my yoga teacher didn't even want to hear me the other day, couldn't hear me. So I wouldn't be doing that. I would be working on breathing light to breathe right, and my 4 in and 6 out breath all the time. And then you'll see the difference.
Awesome. Thank you. Well, thanks for coming on. Thanks for taking me through all the breath work. We really appreciate you. Thank you so much. And to everybody watching out there, breath is important. Everything that we have that can heal ourselves, we have for free. Meditation, mindfulness, sleep, sunlight, breath work. We all need to get back to nature. I mean, or at least learn about our bodies and learn about the power that we have within. So thanks again, Bryan. Till next time, this is Dr. Group with Global Healing, and live healthy, live happy. Thank you.